Organisational Culture in a Merged Academic Health Science Centre. Dr. Anne Mottram, Director of Transformation. This short presentation provides an introduction to mergers and their policy context. It outlines the importance of the subject and provides details on the study, its methodology, results, and its contribution to this growing field of knowledge. Introduction to mergers. A merger is the dissolution of one or more organisations and their incorporation by another. Mergers are rooted in transformational change so that there is an intentional change in how the organisation will conduct its business or operations, in particular with a view to its competition with others. While there is a regulatory process around mergers in the NHS through the Competition and Markets Authority, the decision to merge NHS hospitals is seen to largely depend on national politics. And due to this, it can lead some organisations into overstating the benefits of their merger case in order to navigate through this political landscape. Policy context. There have always been mergers in the NHS throughout its 70-year history. Today, mergers remain central to NHS policy directives, notably as a means to address a funding shortfall, issues of sustainability of health and social care services, and to support local schemes for integrated devolved healthcare. However, this is despite a mixed track record of success related to mergers. Mergers, a route to success or failure. The evidence tells us that half of mergers fail, 30% add no difference, and half of all mergers are said to destroy organisational value. There is limited evidence of an increase in performance post-merger. However, others state that there is a lack of consistency and clarity in how merger benefits are defined and measured, and that mergers often are considered by struggling organisations. The importance of organisational culture in mergers. Organisational culture refers to shared assumptions learned by a group and taught to those other members of that group. There is evidence in the research literature of a link to performance in mergers and to the experience and satisfaction of the workforce. Workforce are said to play an underestimated and important role in the success or failure of mergers. Research study methodology and setting. This study was developed with Harvard and Imperial College to address an evidence gap into healthcare mergers. It is a mixed method study using a case study design with institutional logics as the theoretical lens. The setting is a £1 billion merger to form an academic health science centre in the NHS between two teaching trusts and a university. Study results. A total of 1,978 staff completed the Organisational Culture Survey, giving a response rate of 24%. There were significant differences in mean scores with the Organisational Culture Survey with clinical group, non-managerial staff, and staff who joined the organisation after the merger, all having a more positive, higher score. A regression analysis was used to identify the predictors of organisational culture, and these were found to be statistically significant for professional group, staff bands, pre- and post-appointment status of staff. Semi-structured interviews with stakeholders had a response rate of 63%, and these were used to explore reasons underpinning the results. In a thematic analysis to explore the study results, key themes were found to be loss, organisational turbulence, different speed in recovery among different groups with adaptation to the merger, evidence of subcultures throughout the organisation, competition and dominance, and a lack of agency for some groups, and differences at organisational levels. Key findings. This study identified several novel findings. Firstly, that 7 years after a merger, significant differences exist among staff groups on their perceptions of the organisation's culture. Pre-merger appointed staff have less satisfaction with the new organisational culture. Non-managerial staff have higher organisational culture satisfaction scores, while managers reported higher stress levels and lower satisfaction with the organisation. Clinical staff had higher satisfaction levels due to their perceived intrinsic value of providing direct patient care.